So, unfortunately, women are not behind men. They're just as likely to have heart disease as men. And I know there's a growing fear that, cancer, we're hearing everyone's having cancer, but in fact, heart disease actually is what, gets most of us. For women, our vessels are smaller compared to men, and we're less likely to have closing off of the vessels, or what we call obstructive disease. We're most likely to have non-obstructive disease. However, the outcomes are just the same as men. I think there's, some myths out there that women tend to not have chest pain. That's actually not true. We do tend to have chest pain just as much as men. However, in addition to the chest pain, we have other factors, like we'll have palpitations, we'll have fatigue, shortness of breath, and a lot of times those symptoms cloud out the chest pain that's in the background. So if that sensation gets worse with activity, when you're wanting to get in the mail, wanting to catch a bus, last year you could have walked a mile with ease. Now you're barely able to walk a quarter of that distance. That's a red flag that there's something that's not right. It's really a lot of factors, but being able to, one, as a patient, know your symptoms, two, advocate for yourself if you're not getting your questions answered. And on our side, as physicians, being able to recognize the symptoms.